Good afternoon, everyone. Thanks for joining us. Today I'm joined, as you can see, by the Chief Medical Officer who will help me later on answer questions. Before then, though, I want to provide an update on the state of the pandemic. You'll be pleased to know that this does include some notes of cautious optimism, and I'll come back to that later on. But firstly, I will run through today's statistics as usual. The total number of positive cases reported yesterday was 318. 149 of these are in the Greater Glasgow and Clyde Health Board area, 54 in Lothian and 34 in Lanarkshire. The total number represents 2% of all of the tests carried out and means that the total number of confirmed cases now stands at 232,661. Currently, there are 97 people receiving hospital treatment, which is 3 more than yesterday, and 6 people are receiving intensive care, which is 1 more than the position yesterday. Sadly, I have to report that 2 deaths were reported in the past 24 hours, which means that the total number of deaths registered under the daily definition is now 7,666. And as always, particularly on days like today when we are reporting deaths, I want to convey my condolences to everyone who has lost someone as a result of the virus. Let me also briefly give an update on the vaccination programme. As of this morning, and I'll slow down a little bit here for the benefit of our signer, as of this morning, 3,138,366 people have received a first dose of the vaccine, and that's an increase of 16,421 since yesterday. In addition to that, 29,035 people got a second dose yesterday, and that brings the total number of second doses now to 1,881,214. And as those of you who are quick when it comes to adding up different figures will already have worked out, that means as of today, more than 5 million doses of vaccine have now been administered in Scotland. That's a fantastic milestone, but it is also a massive logistical achievement for all of our vaccination teams across the country. So I want to say a very big thank you again today to all of them. Now, as I indicated earlier on, what I want to do today is really give a brief overview of the current situation, but also a bit of an insight into the factors that we need to weigh up in the days ahead as we try to get Glasgow back onto a similar track to the rest of the country, and as we try, hopefully, to make sure that all of us continue our path out of restrictions and back to something much closer to normality. Today's figures show quite a similar pattern to the one that we've been seeing now for the past couple of weeks. So in summary, we're seeing a rise in cases overall just now. If you look back over the past 16 days, case numbers, albeit from a very low level, have actually doubled. And while some of this will be down to increased testing, the test positivity rate has also been creeping up as well. Now, some of the increase in case numbers being recorded just now will be due to the easing of restrictions over the past month. As we know, when we mix more, the virus does have more opportunities to spread. That is why it is so important, as we do ease restrictions, that all of us continue to follow basic public health advice on things like distancing, face coverings and hand hygiene. But another important factor in the recent rise in cases does seem to be the presence of this April 02 variant, which is thought to be more transmissible than other variants, including the one that was identified in the UK back at the turn of the year. So case numbers are rising just now, but it is important that we put all of that into context, because although case numbers are rising, they do still remain quite low relative to the situation we experienced in the early part of this year. And the same is true in terms of hospital and ICU admissions. Numbers are increasing. So last Tuesday, there were 70 patients in hospital and 4 in intensive care. And as of yesterday, there are 97 in hospital and 6 in intensive care. Again, though, context is important. Back in January, at the peak of this second wave, there were more than 2,000 people in hospital as a result of COVID. Today, that figure is 97. So that gives you a sense of context. And obviously, a really important difference between January and now is the scale and the extent of vaccination. And an increasingly vital part of our consideration as we go forward is understanding the impact of vaccination and the extent that this is enabling us to change our response to the virus. Up until now, we have sought to respond as quickly as possible to rising case numbers. And the reason for that is simple. We have known that increasing case numbers lead within 3 to 4 weeks, almost like night follows day, to significantly increased hospital and ICU admissions and unfortunately to increased numbers of deaths. And that means the priority has been to stem increases in case numbers as quickly as possible, and that has made tough restrictions necessary. Of course, while we're still developing our understanding of the impact of vaccination and given that people's health and in some cases lives are at stake, a significant degree of caution is still appropriate, and that's why so far we've opted to keep Glasgow in level 3. But increasingly, we are monitoring whether and to what extent vaccination might be breaking that link between rising case numbers and significantly rising cases of serious illness and death. And if that does prove to be the case, as we hope it will, then we hope that our response to this virus can increasingly evolve as well. In short, while care will still be needed because there will always be people who require hospital treatment, it might mean that we don't have to react quite so aggressively with tough restrictions in the face of rising case numbers. Instead, we hope that we'll be able to rely more on enhanced public health interventions like testing and vaccination, and of course on good public health practices on the part of the public. So I'm setting this out really to help all of us understand that this will be a key factor in our decision making in the coming days and indeed beyond that, both in relation to Glasgow but also in relation to the country more generally. And I want to give a quick update on the situation in Glasgow and East Renfrewshire, and I'm pleased to say that there is some signs for cautious optimism here. Firstly, it appears that the situation may have stabilised in East Renfrewshire, and indeed case numbers there may in fact have fallen very slightly. That said, it's too early to be absolutely certain, so it remains really important that residents continue to come forward for testing and vaccination and that everyone continues to exercise care. In Glasgow, the 7-day average of new cases has increased from Friday, from 112 new cases per 100,000 people to 137. That said, it's important to recognise that the extensive public health efforts that are underway in Glasgow will take time to work through, given the scale and complexity of the city. So it's important we don't lose heart. And in fact, just in the past 2 days or so, we do think we may have started to see signs that case numbers in Glasgow are stabilising. And test positivity has also remained fairly stable over the past few days at around 4%. So that would be another reason to be cautiously optimistic that we're not seeing test positivity shoot up on an ever-increasing basis. So all of that means the enhanced testing and contact tracing, the acceleration of vaccination, is all, we think, having an effect. So it's really vital to stick with it. These are big community efforts, and I want to thank everyone who's played a part. I know, for example, in my own constituency, Glasgow South Side, health teams have been going door to door to encourage testing. Many thousands of testing kits have been distributed. An additional vaccination clinic has been established in Glasgow Central Mosque. And that last point highlights the contribution that community and faith groups are making. For example, I know the imams have been demonstrating how to use lateral flow tests during prayers. And I hope and expect that all of these community efforts will continue to have an impact. So we'll continue to monitor the latest data for these areas, and returning to what I said earlier, we'll be looking not just at case numbers, but also at the data on hospital and ICU admissions before making the next decision on levels later this week. Now, the final point I want to make here today is that all of us continue to have a part to play. And in particular, let me emphasise once again the importance of vaccination. The latest data shows that 2 doses of either vaccine offer high levels of protection against this new variant. we also expect that vaccines will offer even higher levels of effectiveness against hospitalisation and the risk of dying. So we are currently working to accelerate the programme as far and as fast as supplies allow. That includes speeding up second doses. Obviously, we can only vaccinate if everyone comes forward when they get their appointment letter. At some sites over the weekend, we saw quite a high level of non-attendance for appointments which had been scheduled, although it is important to stress that overall uptake rates remain incredibly high. And it's also important to say that when people don't attend, there will be a variety of reasons for this, and some of them will not be down to the individual. So nobody is pointing any figures here. On the contrary, we all have to work together to make sure we get uptake rates and keep uptake rates as high as we need them to be. For all of us, that means recognising that getting vaccinated is about protecting ourselves, but it's also part of our civic duty to each other and to our wider communities. For government, it's about making vaccination as easy as possible, and we will continue to explore and implement all possible ways of doing that. Today, briefly before I finish, there are two asks that I want to make. The first is for anyone who thinks they should have had an appointment but hasn't, and in some cases this might be because you've moved house recently, for example. Please go on to the NHS Inform website to arrange an appointment. The vaccination section of the site has a section on missing appointment details, which provides a form you can submit. Alternatively, you can call the hotline on 0800 030 8013. And doing that means that if your appointment has been missed because of, for example, wrong address details, it can be rearranged. And secondly, if you're aged between 18 and 29, you can now register online for vaccination. That helps to ensure that your details are correct and up to date. You can register at this address, www.register.vax.nhs.scot. I can tell you that in the first 16 hours of this online system being operational yesterday, over 22% of everyone in that age group registered, which I think is brilliant. So if you're in that age group and you haven't done so, please register now. And if you're watching and you know someone in that age group, please make sure they're aware of this new online system. And just a reminder, www.register.vax, that's vacs.nhs.scot. And that's the note I want to end on. This is a bump in the road with this new variant. There are some positive signs in these outbreak areas, and we need to stick with what we're doing to make sure that they continue. But overall, we all have a part to play in making sure we keep this under control. So continue to follow all of the advice, continue to take all of the necessary precautions and mitigations. And if we all do that, and if we all support this incredible work that our public health teams across the country are doing, then I do remain confident that we will stay overall on the right path, and that is a path back to the normality that we all crave. So thank you very much again for listening and bearing with me through that update. We'll move on to questions now, and Gregor will add to some of the information I've given as we go through the questions. But first today, Conor Gillis from the BBC.
Thanks very much, First Minister. Just back to the situation at the Hydro over the course of the weekend. NHS Greater Glasgow and Clyde said yesterday that it was working with the Scottish Government to try and establish the cause or the reasons for the significant number of no-shows. Have you been able to establish that at this stage? And do we know if it's just the Hydro or is the issue more widespread? And then second of all, to the Chief Medical Officer, looking at Clackmannanshire, how concerned are you around the situation there? And do we know if it's community transmission or is it clusters that can be traced back to certain households? Thanks very much.
So what we know in terms of the do not attends for vaccination appointments is that percentage overall across the country is higher now than it was at the start of the vaccination programme. It's been particularly high over the weekend at the Hydro, but it's not an issue that is only affecting the Hydro. Now, there will be more than one factor at play in that, and while we will and are trying to understand that in as much depth as possible, it's also important that as we're doing that, we get on to address what some of those are so that we are trying to rectify it as we go. Some of it will be as we go down the age cohorts, perhaps more people that think this virus is maybe not a threat to them and therefore they don't come forward. In my anecdotal experience, I don't think that's a significant issue. I think by and large people are really keen to get vaccinated, but round about the edges we may have that. Also, younger people who are more likely to be working may just be finding it more difficult to make appointments, so we need to try to accommodate as much flexibility within the system as possible, as we are encouraging people to understand why it's so important that all of us get vaccinated. Then there will be issues about, just as I've spoken about, people's address details perhaps not being up to date and letters not going to the right place. And that's why if you haven't had an appointment, go on to the website so that we can quickly rearrange it. And of course, as we go, the registration portal for young people is helping to address that at the outset, because if you go on and register, you're making sure your details are up to date. So as we go, we're trying to develop and evolve the system to make it as responsive and as accessible as possible, and that work will continue. Final point I would make, or final kind of observation I would make, which we shouldn't forget, is that uptake rates are very high. So this is a relative thing, and we want to nip it in the bud so that we continue to make sure the overall uptake rates are high. But if you think back to the start of this year, where we were reporting in the older, frailer groups of the population uptake rates that I never thought we would get anywhere near, of virtually as close as you can get, practically to 100%. So there's lots to be positive about here, as well as the data on the efficacy of the vaccine. But we just need to make sure that we're continuing to deliver a system that is flexible, responsive, accessible, and we're continuing to get the message across that it really matters to come forward and get vaccinated, and to come forward not just for your first dose, but for your second dose as well. Gregor.
Just to emphasise that point, over 25 years in medicine, I've never known a vaccination programme that's got such high uptake rates as we're seeing with this current programme that is underway in Scotland just now. In relation to Clickmanager, of course, whenever we see the 7-day case rate begin to increase in any of the areas, it's something that we take seriously. But I want to emphasise the 7-day case rate isn't the only data that we rely upon or that we need in order that we assess the situation there. So although we've seen this climb in the 7-day case rate there, we understand what is driving that. And in Clickmanager, which has a relatively small population for a local authority, just a small number of cases can actually drive that 7-day case rate up quite substantially. And what we know of that current rise there just now was discussed at the National IMT just yesterday, is that those cases are predominantly in younger age groups, that they are associated in a cluster, and that at this point in time there is no evidence of continuing community transmission in that area as well. And in fact, over the last few days we've actually seen the daily reported numbers begin to reduce now as well. We're talking about numbers which are actually less than 10 cases per day in some instances. So you can see how that can have a disproportionate effect. Really important that we continue to monitor it, but at this moment, as I say, it's just a case of making sure that we keep on top of this.
Gordon Cree from STV.
Thank you. On this issue of the positivity and saying that looking at numbers in hospital and intensive care is now potentially more important than just case numbers, is it fair to say that you have changed tack from the previous position last summer of advocating an elimination strategy to now more of a, we'll just have to live with the virus because vaccinations might allow that? And on the subject of the take-up rate for vaccines, you've talked about younger people being able to register to be notified, but it's still registering to be notified about when their appointment is. Is there a case that the uptake rate might be higher if we had a system where people were invited to go and book their own slot?
So in relation to your first question, I still think it's really important that, taking everything into account, we try to keep case rates as low as possible, because the lower they are, the less chances of transmission, the less chance of new variants developing. So that is important. But vaccination changes the game in some respects from last summer in how you deal with this. And if vaccination is breaking, it won't break completely the link between case numbers and hospitalisation. If you recall, Jason on Friday explained, that you've got a spectrum from people with the virus having no symptoms through to the other end where people might die. And what the vaccination does is hopefully push people down that spectrum, so it reduces the severity of illness. So you will still get people being hospitalised, but not, we hope, to anything like the same extent. And those who are hospitalised hopefully are not as seriously ill as they would have been had they not had the vaccination. So, there's got to be a point to us having a mass population-wide vaccination programme, and that is it does allow us to change how we deal with this virus and deal with it in a way that has much less restriction on our day-to-day lives. Now, we're in the position right now, we're almost in what I would describe as a bit of a transition from how we were dealing with it to how we hope to be able to deal with it, because we don't yet know or understand the impact of vaccination as much as we want to, but I hope that we can migrate to that. But does that mean any of us should just throw caution to the wind about getting the virus or being relaxed when we've got case numbers rising? No, we of course want to bear down on it, and that comes down to every single one of us trying to do all the things that stops it spreading, but moving to a situation where we do get our normal life and operation of our country back to something much closer to what we all want it to be like. And on your next question, we've chosen how to do this vaccination programme in a way that allows us to match administration of doses with supply as much as possible. That's why we've done the blue letters. But as we go further into it, yes, we are looking at how do we change it and make it more flexible and responsive. One of those things may be people can go on and change appointments already or rearrange appointments. But just as we have launched the registration service, we will be looking as we go at how we use an online system. So rather than just registering, can you go on and book your appointment? These are all the kind of things that are under consideration as government tries to do our part of the deal. The public's part is to come forward when they're invited. Our part of the deal is to make sure the supplies are there and the administration of the system is making it as easy to use and as accessible as possible. So we've been, myself and Gregor and the Health Secretary have been having some discussions about that already over the course of the morning. Do you want to add anything, Gregor?
I would just add that just from a clinical perspective, it remains really important to keep the cases as low as possible. But we're in this very fortunate position that we've got the vaccine programme just now, which is going to do an awful lot of that heavy lifting for us now and in the future as we start to complete those second doses, because the evidence, the very early evidence that we're seeing, even against 1617, is that this vaccine programme is going to have a very positive impact on reducing the proportion of people who would have symptomatic infection and therefore be able to pass it on to other people. So I'm really encouraged by some of those initial results. We should continue with it, and we still know that the vaccine programme is going to be one of the absolutely critical parts of our overall response in getting back towards normality.
Gregor's articulated that, I think, in a really helpful way. It's not about us not controlling the virus anymore, it's about how you control the virus. So the extent to which vaccines replace restrictions as how you do that. Because what we hope is that, yes, vaccines will reduce the serious illness and hospital cases, but it will also bear down on the transmission and the case numbers as well. So this is about just having different tools in our box to try to achieve the same overall objective. Peter McMahon from ITV Border.
Thank you very much, First Minister. First Minister, on Friday, the Scottish Government published a short list of places in England where you said people from Scotland should not travel to, and that was by law, and that was Bedford, Bolton and Blackburn with Darwin. The UK government didn't publicise the list, and that's caused a bit of controversy with local politicians saying they weren't consulted. But the list is now out there, and that includes a wider number of places in England, and perhaps most relevant to the south of Scotland includes North Tyneside. So I wonder if you could say whether or not people from Scotland should not travel to these other places, specifically to North Tyneside. If they shouldn't, what are the sanctions and what are the exceptions?
So obviously, you're right, there has been a bit of confusion overnight about the advice that the UK government is giving in terms of travel from one part of England to the other. We are seeking to look at what has been published and make an assessment of whether our restrictions in terms of the legal restrictions we have in place, which were for the areas outlined in Friday, should be extended to cover other areas, and we'll update on that, should there be an update on that, as quickly as possible. And the list of exemptions in terms of essential purposes for travel is included in the law. What I also said on Friday, though, and this would continue to be my advice, is not to travel, if you're in Scotland, not to travel to any areas in England that are currently the subject to, forgive me if I'm getting the precise terminology wrong here, but enhanced public health interventions. So areas that are effectively outbreak areas where that has been recognised as such. So the additional areas that are on the list that has emerged in England are probably covered by that more general advice, but we'll be considering whether we want to take any particular areas from the realms of the general advice not to travel into the legal restrictions on travel. But we'll consider that in short order and update if there is a change to the current situation. Joseph Gartley from Borough.
Hi there, thank you. So Dumfries and Galloway currently 7-day rate per 100,000 is sat at 2, which equates to about 3 cases in the 130,000 or so residents. At what point can you start moving that down a level? Because it's doing better than the places that were level 1 were when they got moved down.
So again, I just make the point that Gregor made earlier on in response to a different question. Rates per 100,000 are not unimportant, and I'm not saying they are, because often we quote them, but they're not the only factor that has to be taken into account. We've had these kind of debates and discussions around areas like Dumfries and Galloway before. The sort of proximity to areas with higher rates is one of the other factors. But in answer to your question, when do we hope Dumfries and Galloway will go down a level, then that is at the next review point, when we're hoping that most of the country, if not all of the country, can go down to level 1. Now, clearly Glasgow is still at level 3, so there's, we've got to get Glasgow down to level 2 first, but we hope that the direction of travel for the rest of the country will continue to be down those levels of protection. Back to level 0 at some point over the next few weeks, all being well, and then into a situation beyond level 0, which we'll set out more detail on shortly. So hopefully Dumfries and Galloway will continue to go in the right direction, not just in its case rate per 100,000, but in all of the other indicators as well. Alan Zizinski from Global.
Thank you very much. Just on the Glasgow situation again, Scottish Labour's leader Anna Starwer said this morning, to quote, "We shouldn't be afraid to call in the British Army if necessary to get the boots on the ground for more mass PCR testing and more rapid vaccination." I know the Army has obviously previously helped with vaccine centres. Has there been discussions about using more of their resources in Glasgow South Side particularly, or are they already doing that?
We will continue to call on the Army when and if we think that is required, and there's no hesitation in doing that, and I'm sure we will sort of make use of Army resources at points in the future. But as I'm sure the leader of Scottish Labour knows, then health teams have been going, door to door in parts of Glasgow South Side, delivering tests, encouraging testing, and it's for public health teams to make judgments on the balance between the use of lateral flow testing, which gives much quicker results to test than PCR testing does, and then allows PCR testing to be used as confirmation in the case of positive results. But PCR testing is being used to a considerable extent in the south side of Glasgow as part of the routine asymptomatic testing. So I'm not just satisfied, I'm very impressed with the public health response in Glasgow South Side. It is my constituency, so I know the area and the populations there extremely well, and I think the response has been excellent. So we've got to support our public health teams to continue that. As I said today, and I don't want to labour this point too much because it is early days on this, but the signs over the last couple of days are that we've seen the situation in Glasgow start to stabilise, which is really encouraging, and particularly encouraging that we're not seeing continued we don't appear to be seeing continued exponential growth. So that stabilisation would say to me that the efforts are working, and therefore what's really important is that the public health teams in Glasgow stick with them, but more importantly, that all of us as residents in Glasgow continue to do all that is asked of us in terms of testing and coming forward for vaccination. Do you want to add anything to that?
Yeah, I've been really impressed by the overall response in those areas of Glasgow just now, and it's the public health teams coming together with people from the local government, but also a number of different voluntary and community groups all working together in these areas, and that coordination of local action where those people know the communities has been incredibly helpful in making sure that we've seen such an effective response as we've seen to this point in time. I remain in constant dialogue with the public health teams there, and they're not signalling any need to increase any of the resources into that area at this point in time at all.
Nicole Castles from Central FM.
Thanks, First Minister. So just looking at Clackmannanshire, I just wondered if there's any indication of the Indian variant spreading there. And just secondly, going back to the case rates, Midlothian actually has reported more positive cases than Clackmannanshire, with 75. Clackmannanshire has only reported 72. So is there perhaps another way to measure smaller areas without making it look like the virus is possibly worse than what it is by the infection rate?
Well, to be fair to ourselves, we always stand here and say you shouldn't look at the, again, I don't want to sound as if I'm contradicting myself. The case rate per 100,000 is not unimportant, but if you look at it in isolation, it can be misleading, particularly in areas that have smaller populations. That's why in the strategic framework that we published, the updated version, I can't remember when, some weeks ago now, before the election period, we have a basket of measures that we look at. And in addition to those metrics, we also take account of just a lot of local public health intelligence. As Gregor just said, in Clackmannanshire, although the case rate per 100,000 looks high, it's actually a very relatively small number of cases overall, and they can mainly be traced back to specific clusters. So there's not evidence of widespread community transmission. It's the point I was making on Friday. On the face of it, when we looked at Glasgow and East Renfrewshire, they should both be in the same level, but East Renfrewshire, actually, smaller population, we were much more confident of where all of these cases came from and what they were related to, and we start to see, we hope, the situation in East Renfrewshire stabilising. So it's really, and I, as a decision maker, I find this, difficult at times as well. We've got to be really nuanced about how we use all of this data, and the data without a really deep understanding of the demographics and the nature of a population and what is driving the case numbers actually doesn't mean that much. So it's what the local public health teams tell us about their understanding of transmission that is often the most important thing that we have to base decisions on. So I know that's difficult for everybody, because the instinct is just to look at the headline figures, and as I say, they're not unimportant, but the decisions have to be based on a much more complex analysis of the overall situation, and that's certainly true in Clackmannanshire, given the relative smallness of the population there. Neil Pooran from PA.
Thanks, First Minister. In terms of the expanded testing you're doing in the south side of Glasgow, can you maybe say a bit more about what the extent of this is? Are you basically looking to test every single person in those affected postcodes? And on the issue of vaccination, are you considering at some point in the future maybe having just drop-in centres for vaccination where people can simply turn up to be vaccinated?
On the latter part of that question, we want to make sure that we're using the supplies we've got right now, and we've got healthy supplies just now, but they're not unlimited supplies. So the danger of just moving straight away to a drop-in is that you end up vaccinating people who are, relatively speaking, less likely to get seriously ill and die from the virus than those, or ahead of those who are more likely to fall. So we need to try and have a sort of strategic approach to this, which is in line with the JCVI advice, of course. As we go further through this, of course, we will use different approaches to get to people as quickly as possible. You're already seeing that in Glasgow, where younger people are being invited in. We've been discussing with the Hydro, for example, if they have a higher rate of do not attends on a particular day, there should be a system for getting people just to come along and take up slots that are available. So as we go further through this, absolutely, there is a need to be more flexible. Because also, as we go further through, we are more confident we've got to everybody or those that are at the highest risk. So this is a programme that will continue to evolve in terms of how it is delivered. First part of your question on testing. So the advice to everybody all over Scotland, actually, not just in the south side of Glasgow, is order lateral flow tests and get and test yourself twice a week. You can do that through the government website. So we want people to use testing and see testing as part of our overall protection against the virus. In addition to that, the public health teams in Glasgow are going to targeted areas on a door-to-door basis to encourage that. There has been an increase in the availability of testing sites in the south side of Glasgow. So there's a whole range of different approaches being brought to bear there to make sure testing is as widespread as possible. But if you haven't had a knock on your door, that doesn't mean you can't get tested. You can go to one of the testing sites and there's information available in Greater Glasgow and Clyde Twitter feeds about where those sites are, or you can order a lateral flow test. If you go online and order a lateral flow test, a pack of lateral flow tests today, the likelihood is they'll come to you tomorrow. I ordered some last week or at the end of the week before, and they came the next day. So it's a very quick service. So make use of that. It's one of the ways in which we can all play our part in making sure that if we have the virus but not showing symptoms, we're identifying that and able to isolate ourselves and stop inadvertently the risk of passing it on to others.
I want to see as many people testing in those areas as possible, and one of the really important features of the teams in those areas just now is the way that they're engaging with those local communities to tell people about the advantages of testing. And whether you've been vaccinated or not, whether you've had COVID-19 in the past or not, I'd still encourage everyone to seek that testing, because what we're trying to do here is we're trying to identify the roughly a third of people that exist who have COVID-19 but aren't aware that they have it and may still be able to pass it on. And if we can get to those people, if we can say to them that you've got a positive test, we advise you, we need you to isolate to stop it from spreading, that stops that transmission from happening in those areas. So my advice to everyone in that area is test. And don't just test once, test more than once. If you've had a negative result, think about getting a test again in another few days just to make sure that you've not become infected in the in-between time as well.
Conor Matchett from the Scotsman.
Thank you, First Minister. Just to start on whether or not the planned increase in crowd capacity in Glasgow for the Euros is still planned to go ahead. And secondly, the National Records of Scotland yesterday told me that they are going to publish a breakdown of COVID-19 deaths by individual NHS facility. That comes after we had a bit of a transparency battle with them at the Scotsman. Do you welcome the additional transparency that will come with the publication of those figures? And do you think that you should have been publishing those since the start of the pandemic to provide a little bit of additional transparency to the whole process?
In answer to the first question about crowds in stadiums, there's no change to the current position. I hope there will be no change to the current position, but it is a statement of fact that we have to keep all of that under review in light of the current situation. NRS is an executive agency of the Scottish Government, operates independently. It wouldn't be right for me as an organisation particularly that deals in statistics and the publication of statistics to dictate what it does and doesn't do. I have always, and we have, if you go back to the outset of this pandemic and compare what we published in the early days compared to what we publish now, it is like a different world. We have, as we've gone through, tried to increase the data that we've been publishing, what that data covers, the breakdown and granularity of that data, and we will continue to do that. So I welcome anything that contributes to that. On the specific point being raised here, I made these points on Friday. I think it's worth bearing them in mind that to use your term, Conor, the transparency battle you've been having with the NRS is, contrary to how this was reported in some outlets, was never about the scale of deaths in care homes. That has always been known. It was about the breakdown of that number between different care homes. And secondly, that information has to a large extent been published. It was published by the Crown Office actually some weeks ago. So NRS clearly have to respond to decisions and judgments of the Freedom of Information Commissioner, but there's always a desire to see as much information and data published as possible, not least to inform our own response, as well as to make sure that the public has great and as deep an understanding of the situation as possible. Tom Martin from the Express.
Hi, thank you, First Minister. Could I just return to your opening remarks, firstly, where you talked about the impact of vaccines lessening the need for perhaps tougher restrictions in future. How confident or hopeful are you now of seeing no further lockdowns? And secondly, if I could just pick up on an earlier answer you gave in relation to moving to a more direct booking system. You said all of these things are under consideration. I just wonder what difficulty or what has prevented such a system being introduced so far. Because as I understand it, in England, there is a position where there is more opportunity for direct booking. Thank you.
I'll come on to that in a second. You asked me how hopeful and how confident I am that there'll be no further lockdowns. On hopeful, as hopeful as it is possible for me to express, I literally hope with every fibre of my being that there'll be no further lockdowns. How confident am I? That will develop as our understanding of the impact of vaccination develops. I've tried to stand here, at every juncture in this pandemic and strike a balance between being as optimistic as possible with the public, but not feeding false optimism. So we need to continue to navigate our way through this. I'm more confident now than I would have been a few months ago that the vaccine will genuinely get us out of this. And we're learning more about it every day, and most of it is on the upside of our expectations. So my confidence is growing, but what I know is we will have more chance of avoiding further setbacks if we continue to take a careful route out of the situation that we find ourselves in now. And I know that's really frustrating because everybody wants to be out of it straight away. But the more considered and careful we are now, the more chance we've got that we will keep going in the right direction. As we're seeing just now, nobody can guarantee in any part of the UK, in any part of the world, that we won't have bumps in the roads or setbacks from time to time. But overall, what we want is our direction to be thoroughly forward. And I'm reasonably confident that we can, with all the things that I'm speaking about right now, being done by government, by the public, by all of us, that we can achieve that. In terms of the online booking system, Scotland and England, we've administered this system slightly differently in some respects. Actually, our overall vaccination rates are pretty identical. There's a little bit of variance from time to time, but they're broadly speaking the same. So that suggests we've maybe been taking different ways of doing it, but we're achieving the same outcomes. The reason we have taken the approach of sending people letters, and that is because we're trying to follow the clinical advice that says vaccinate those most at risk first. So when you take that together with having limited supplies, the danger, particularly in the early stages of a programme like this, is if you just allow people to come on and book, is that you end up getting the order of vaccination. Everybody wants to be vaccinated straight away, that's natural, but we would get the order of vaccination out of sync with the clinical priorities for vaccination, and we may also get it out of sync with the supplies that we have. So we've tried to do it in a very strategic, managed way. As we go further down the age cohorts and the risk cohorts, though, that opens up the possibility of having different, more flexible, more accessible approaches, and that's what we are at pace considering now in terms of injecting some different routes into vaccination into the system. Dan Vevers from The Sun.
Thank you, First Minister. Just back onto case rates. Last week when East Renfrewshire had a similar case rate to Glasgow, Hamza Youssef spoke about how the absolute case numbers were much lower in East Renfrewshire, and that made it more straightforward to cope with. And as we know, East Renfrewshire was able to stay in level 2. You both made similar comments today about partly fueled the Glasgow outbreak, or the Home Office protest in Pollokshields. Thank you.
Look, I can't ever be absolutely certain about things either having or not having an impact on transmission. You've heard me say that in other cases before, so I'm not going to stand here and try to be definitive, just because it would be things that I would love to be able to be definitive about. But if you take the election, for example, if that was true, then presumably you'd be seeing the same pattern all over the country, because it wasn't just in Glasgow that we had an election. We had an election in the whole of the country. So we're not seeing that consistent pattern. So that would suggest that that's not the driver. The Kenmure Street protest, and the situation in Glasgow had started before that. One of the reasons I was so furious with what the Home Office did that day was because they knew they were doing that in the midst of an increase in cases. So that increase in cases had already started in Pollokshields. In fact, the day before the Home Office protest, I, with Hamza Yousaf and Sarwar, came with us. We went to Glasgow Central Mosque, because it was the day before Eid, to say we've got rising cases in these populations, be really careful. So it's not the case that that started, that it was already underway. We've all got to be careful in what we do as restrictions ease, to try to minimise the opportunities for transmission. And in terms of structural disadvantages, look, Scotland's got several cities, and all bar one of them have moved down the levels as planned. So that would suggest that that's not quite as simple as you're making it sound. And I hope that before too long, Glasgow's back on track, coming down those levels of protection as well. I suppose what we do know, though, and this definitely has a relevance in cities, and you would find this if you look at the areas with outbreaks in England as well, is that in areas of greater population density, it's, I guess, perhaps less about the overall size of the population, although that can skew the statistics. It's less in terms of transmission about overall size and more about the density of population. And in inner city areas, in the south side of Glasgow, again, my constituency, lots of tenemental living. In our Asian populations, lots of multi-generations living in the same accommodation. So those patterns of how people live undoubtedly have an impact on transmission. And that means we've got to try and tackle that and reduce the risks as much as possible. But I think to simplify it, to say cities are always going to be in a higher level of restriction is just not borne out by the reality right now. We need to get on top of transmission, and that's why the work that is being done in Glasgow right now is so important. And we think, she says, touching what is not wood, but I'll touch it as if it is wood, we think that's starting to have an impact.
Dan, if you look at the experience of any pandemic over the last couple of centuries, whether it be flu or the current one that we're experiencing with this particular coronavirus, we know that it's those more densely populated communities that are more likely to have higher case rates, and there's lots of factors as to why that's the case. People come together more readily, households tend to be larger, people are maybe living in houses with multiple occupancy and kind of multiple generations as well, and all that creates the perfect environment for spread to happen. So that's something which is, if you like, an acknowledged and accepted a fact of how you manage any public health outbreak, whether it's in a pandemic proportion or whether it's in a more localised outbreak response for some other infectious disease as well. All these things are taken into consideration, particularly by the local public health teams when we're forming a plan as to how to tackle that particular outbreak. And that's why the response is very tailored to the situation and the environment in each one of those places. And sometimes the response can be different in a more rural community than in a densely populated city community as a consequence of that. What we're trying to learn just now in terms of the new April 02 variant is, does it have any inherent characteristics of the virus that give it an advantage in those type of scenarios? Or are some of the spread patterns that we're seeing, particularly in England just now, how much of that is contributed by the environment that it's actually spreading within?
Watson from the Daily Mail.
Thank you, First Minister. I just want to go back to the vaccine rollout, and it seems over the last couple of weeks we've seen it really ramping up with people in the 30s age group and now people 18 to 29 being asked to register. Are you hopeful of beating that end of July deadline to get a second dose to all adults? Do you think that's possible? And secondly, do you have a target date for getting everyone their second dose? Obviously, it would seem that would be 12 weeks after the first dose, but given that you've spoken about getting those second doses into arms faster, how much faster are you talking, and do you now have a date that you would like all those second doses to be done by?
So in terms of the first doses, our target date is still that end of July 1, but supplies permitting, we certainly are confident we can be within that, and we want to get that done as quickly as possible. We haven't given a specific date for completion of second doses yet, not least because the advice, as you know, around the interval has changed. So it's gone from 12 to 8 is the recommended interval. So we've been remodelling all of the projections around that. The biggest single limit on the pace at which we can do that will be supply. So we want to do that as quickly as possible, and second doses are being accelerated. And as and when we can get to putting a firm target date on that, we will do so. But it is going to be quicker than would have previously been anticipated. But we still need to make sure we've got the supplies to do it all in the 8-week timescale for those who, of course, haven't passed that period yet.
Last week I wrote to each one of the Scottish Health Boards just to update them on the advice that had come from JCVI, and that was to bring forward the date or the timing of the second dose from 12 weeks to 8 weeks, but particularly to prioritise that move to 8 weeks in the areas where there was evidence of the April 02 variant being in circulation and posing a threat to the local communities. That work is already underway just now. We also need to, at the same time, to make sure that we're maximising the uptake of the vaccine in those people in the at-risk groups who've yet or decided not to have it, that we're perhaps re-engaging with those to speak to them again about the possibility of getting a vaccine if they've chosen not to have it beforehand or they've been unable to get it beforehand. So I think all of those steps mean that we stand the greatest possibility of reducing any impact that this new variant has on these communities.
Helen Puttert from The Times.
Thank you. I wondered first if I could just ask for an update on the numbers of the Indian variants and where you're seeing them in Scotland. And secondly, given the figures which are out today, showing the waiting times for patients and the different capacity that we have in the NHS, could you tell us a bit more about your plans to increase NHS Scotland activity to 110% of pre-pandemic levels within a year? Can you tell us if that would involve the private sector at all or any extra NHS staff, and when a plan might be published? Thank you very much.
The plan for that will be published within the first 100 days of our government. We set that out in the 100 days plan. Actually, there will be, I make a statement in Parliament tomorrow about our 100 days plan, and that will be followed up over the next few weeks by more detailed statements in different policy areas, including health, and the remobilisation recovery plan that we will publish within the 100 days will set out exactly how we're going to increase NHS capacity. It will involve increasing NHS staff. It will involve maximising and bringing extra capacity into the National Health Service and using capacity from wherever we can find it, but it will also involve quite a considerable amount of looking to redesign, pathways of care in order to maximise the patient experience. And the new Centre for Sustainable Delivery in the NHS is a part of that, as we look to the different ways in which we can make care more efficient, quicker, and have better outcomes for patients. But all of that will be set out, or the direction of travel and all of that will be set out in the plan that we publish within the first 100 days. And the first part of your question has just gone straight in my mind. Remind me what it was.
Just the numbers of the different Indian
the numbers. I remember on Friday it was 136. I'm going to look to Gregor to see if there's been an update on that.
So Helen, we should get an update on that today, and we'll be able to forward that to you. One of remember, that's confirmed cases from whole genomic sequencing, and there's a bit of a lag, as you know, in terms of how we take that through the system. What we have is another way of tracking those cases which are most likely to be the April 02 variant in Scotland just now. We know that from the work that's been done in terms of validating that whole genomic sequencing with the S gene positivity result that we have in Scotland just now, that about 90% of S gene positive cases that we're seeing in Scotland just now will be that April 02 variant. As of yesterday, 58% of the cases which were identified yesterday were S gene positive. So you can begin to see the way that we've seen the rise in the proportion of cases which are most likely to represent this April 02 variant. As from this week, we've got NHS labs and also the Lighthouse lab in Glasgow, which is now going to hopefully be in final stages of validating and introducing a specific PCR test which will help us to identify some of the mutations that were associated with April 02 virus, and we'll be able to more quickly confirm that that is indeed the virus. It's not just an S gene positive virus, but it's also the virus that we know is April 02.
Helen McCarthy from the Herald.
Hello, afternoon. I just want to ask in relation to some of the hospital patient numbers. So over, well, I think since last Sunday, we've seen the number of patients with COVID in the Greater Glasgow and Clyde area increased from 21 to 49 yesterday. I don't know, it's changed today. But I wondered, could you give a little bit of detail, in a general sense, what the demographics of some of those patients are in terms of, are they younger? What kind of age groups are we seeing? Maybe any information on whether or not they're vaccinated or not vaccinated? And sort of in relation to that, is there a particular threshold that you would be looking for ICU numbers to be below by the weekend before you would consider moving Glasgow into level 2?
I'll hand over to Gregor on the demographics of the hospital cases. And remember, these are really small numbers just now, so there'll be a limit as to how much detail can be given there for reasons of patient confidentiality. I would guard against, very strongly guard against this being about a threshold number for ICU cases by the end of the week. A bit like case numbers per 100,000, it is more nuanced and more complex than that. What we're effectively looking at right now is whether, for any given number of cases, we're seeing the same translation into hospital and ICU cases and people dying that we would have been if these cases had been happening before anybody was vaccinated. So it's not that nobody will be admitted to hospital and nobody will be admitted to intensive care. It's, are we seeing that link between case numbers rising and an inevitable significant rise in the hospital figures? Are we seeing that link become less definite? And there'll be judgments to make around that. And, frankly, at this stage, we can't be certain about whether and to what extent that breaking of the link is happening. But it's not about, as long as there's fewer than 10 patients by Friday, we're okay. It's more complicated than that. And I will do my best to explain it as simply as possible. I hand over to Gregor on the breakdown of cases in hospital as we know it. The one point I would make about the vaccination status of people, remember what Jason said on Friday, what I've alluded to today. It is not the case that vaccination, somebody being vaccinated, will mean that there is absolutely zero risk of them ever ending up in hospital. Vaccination is about pushing everybody down that spectrum of severity of disease. So somebody who is vaccinated and gets the virus, they may still need hospital treatment, but hopefully they'll be less seriously ill than they would have been without the vaccine, and hopefully fewer people will need hospital treatment than before the vaccine. So again, it's not absolutely binary in that regard. But Gregor.
Yeah, and that's a really important point about vaccination is that we know that vaccination influences the severity of the disease. In Glasgow, we had 49 patients in hospital yesterday. Obviously, that's a fluid situation. Some people are discharged, some people are admitted on the day, so data is continually coming in there. But what we're seeing is a representation from those particularly affected postcodes in the south of Glasgow in those admissions, and we're seeing just over a third of the people who've been admitted in recent times have been from a minority ethnic background of some sort. Spread of age groups within that point in time, but further analysis is currently being done looking at vaccination status.
Okay. Lance Anderson from the Telegraph.
Thanks very much, First Minister. You previously said you're open-minded about vaccine passports. I just wondered if we could get an update on your thinking on that for domestic use, so hospitality and mass events rather than international travel, which I know you've already done something for. And could I also please ask Dr. Smith, how big of an issue with the sort of vaccine take-up is reticence to take the AstraZeneca jab in particular, as given what we know about side effects? Is that something you're seeing at all? Thanks.
We continue to do work on the use of vaccine certification, vaccine passports. We're still advising people not to travel overseas unless it is essential, but where it is essential, there is now the availability of vaccine certificates should they begin to be requested by other countries. I think we will start to see domestically, venues or places ask for proof of vaccination, and we need to think through some of the implications of that. We're doing some work with the UK government. We're participating in international work around that. I think we will see greater use of vaccination as a route back to doing things, but as I've said many times before, there are equity and ethical issues in there that we've also got to think through, and that work is ongoing. Gregor.
There's clearly broader work which is being done just now just to try to understand better why there's been a tail off in some of the attendance at the vaccine appointments, but what we're not detecting at all is any reticence to come forward at all because of the AstraZeneca vaccine. We know it's a very safe vaccine. I'm in that same age group, 40 to 49. It's AstraZeneca that I took as the vaccine when I got my first dose, and I'm not hearing any reports from around the system at all that people are not attending or are refusing their vaccinations because they've been offered the AstraZeneca one.
But of course, in line with advice, those in the younger age groups will be offered the other vaccines. So don't worry that you're going to get offered a vaccine that is not recommended for your age group. We are following all of the advice that has been given on use of the vaccine, and all vaccines, including AstraZeneca. I'm a bit older, but I had AstraZeneca as well. AstraZeneca is a safe vaccine, and people should be confident in coming forward and getting the vaccine that is offered to them, bearing in mind that the one that is offered to you will be offered to you taking account of all of the advice on what should be used in which groups. And lastly, Vivian Aitken from the Daily Record.
Good afternoon, First Minister. I've just got a question for the Chief Medical Officer to see if he can give us any indication when people under the age of 17 may get the vaccine. I know there's been trials ongoing into it, and there are a lot of people are concerned if they have children who've got severe underlying health issues that these children should be vaccinated. So are there any indications at all of when we might see it?
So at this moment in time, none of the available vaccines for use in the UK have been authorised by the MHRA for use in those age groups just now. When the companies who manufacture these vaccines submit that data and it's then considered, there'll be a decision as to whether that is then made available, and at this moment in time there's no clear date as to when that's likely to take place. The JCVI, of course, will have to consider their advice as to how we proceed with any vaccination programme, which would include those age groups as well. There's a wider consideration, of course, which is on a global scale, which is about the use of vaccine in that age group, particularly when there are large numbers of at-risk people globally who have not been vaccinated, and how we should proceed with that. But these are ethical dilemmas which are being dealt with in countries all over the world just now, and with the WHO as to how we should proceed with that.
Okay, many thanks, Gregor. That concludes the questions for today. Thanks to all of the journalists. Thanks to Yvonne for our interpretation, and to Gregor for helping me answer the questions. Maybe just briefly give you a sort of look ahead this week, because I know those of you who watch these briefings are always keen to know when the next one will be. Tomorrow I will be giving a statement in the Scottish Parliament, not just on COVID, on the wider plans of the new government for the next 100 days. I think that's around 2 o'clock, but inevitably that will, I'm sure, touch on matters COVID. So if you're interested in that, you can tune in then. Thursday we'll be back to weekly First Minister's questions in the Scottish Parliament around midday. Again, you can get the exact timings on the Scottish Parliament website. And again, that will be an opportunity to hear updates and questions, no doubt, on matters relating to COVID. And then on Friday, we'll be back here at 12:15 with a briefing, and that of course will include the decisions that we reach based on the up-to-date data in Glasgow, and of course any other matters that we need to cover. So that gives you a sense of what to look out for in the week ahead. In the meantime, thanks for joining us, and please continue to do all of the things we know are effective in stopping this virus spread. So the basic public health measures, get your lateral flow tests and test yourself regularly, and please come forward for vaccination as soon as you're invited if you haven't already done so. Thanks very much indeed.